Hello and welcome to Health 247 on Rapid TV, the program that brings you trusted health insights, expert advice, and inspiring stories. Today, we are taking a closer look at the 2025 National Micronutrient Conference. My name is Josephine Bitrus. Thank you for staying tuned. The National Micronutrient Conference was held from 18th to 19th December 2025 at the Nigeria Air Force Conference Center and Suites in Abuja. The conference, themed Strengthening Resilient Systems for Addressing Micronutrient Deficiencies in Nigeria, brought together key stakeholders from health, agriculture, development partners, civil society, academia, and sub-national actors to chart a renewed pathway in addressing what the federal government described as a silent but devastating threat to human capital and national productivity. Stay tuned for insights from the event. The National Micronutrient Conference in Abuja focused on strengthening resilient systems for addressing micronutrient deficiencies, also known as hidden hunger. The event brought together government officials, development partners, and private sector stakeholders to launch new strategies and reaffirmed commitment to improving nutrition through food fortification, biofortified crops, and public health initiatives.
And the theme of this conference, to strengthen resilient systems for addressing micronutrient deficiency, is a theme that reflects our unwavering commitment to building an integrated, sustainable, and evidence-based response to one of the most silent yet pervasive public health challenges facing our country. And we have already heard from many stakeholders who spoke that micronutrient deficiencies affect women, children, adolescents, and the elderly, constraining human capital accumulation and perpetuating cycles of poor health and poverty, in addition to declining productivity. Our collective task is to transform the data, what we know from our various surveys, into actions and to strengthen the system to deliver impact across food, health, education, social protection, water and sanitation, hygiene, and also community platforms. I will confess, when I was first asked to approve for the conference, I said, can we do it virtually? Can we do it via Zoom? And the director told me, oh, why? I said, well, how much is it going to cost? And she said, it's going to cost X. I said, well, shouldn't we use that money to actually have action on the front end to ensure that it gets to where it needs to be? But on reflection, and thanks to the director, she stood up and she said, well, yes, we agree. But at least once in a year, we need to bring all stakeholders together to learn what is, to know about the data, to engage, and to really re-energize ourselves as we take further action. So I said, I completely support that, and I think we're doing that today.
As the ministry responsible for agriculture and food security, we recognize that macronutrient deficiency is not merely a health issue. It is also an agricultural issue, a productive issue, and an economic issue, and a national development issue. Today, more than ever, our country faces the challenge of ensuring that every household has access not only to adequate food, but also to nutrient-dense food that strengthen immunity, support child development, and improve cognitive performance. The success of our national agricultural transformation depends on health and resilience of our people. This is why our ministry is committed to working closely with the health sector, the private sector, research institutions, civil society, international partners, and all stakeholders to promote: 1. Biofortification of stable crops, including vitamin A-rich varieties, iron and zinc-rich grains, and macronutrient-enhanced legumes. The Ministry, in partnership with other relevant stakeholders, has developed vitamin A cassava, orange flesh sweet potato, vitamin A maize, zinc rice, and zinc sorghum. Currently, the Ministry is implementing increased production and consumption of these biofortified crops in the state.
This gathering underscores the magnitude of macronutrient deficiency in our country and reflects our shared commitment to tackling it as one of the most pressing public health and developmental challenges confronting our nation. For us, therefore, our conversation today should not be seen just as a talk, but a national platform for dialogue, for reflection, and for coordinated action to address the severe public health issues which affect millions of Nigerians, especially our children and pregnant women.
Behind every statistic is a mother, a child, a classroom, and a future that must not be left to chance. The findings of the 2021 National Food Consumption and Micronutrient Survey underscore the urgency of this challenge. While Nigeria has recorded notable progress, a significant proportion of our population still does not receive adequate intake of critical micronutrients.
On a larger scale, malnutrition is estimated to reduce Nigeria's GDP by 2 to 3% annually. I'm informed that the cost of procuring essential micronutrients for those who need it in Nigeria is less than 10% of the annual aggregated cost of the deficiencies listed above. Consequently, the economist in me tells me that prevention, as always, is better than cure. The challenges associated with providing adequate vitamin A, iron, zinc, folic acid, and iodine is not lost on us, given that over 80% of micronutrients consumed by our mothers and children are provided directly or indirectly through development assistance by foreign partners. This is a cause for concern in the context of sustainable commodity security, nuanced by decreasing international donor support. What happens if the support dries up, as it could happen in the worst case scenario? The Parliament, especially the 10th National Assembly, through the House of Representatives, led by Rat Honorable Eugene Abbas, PhD, TCON, set up this committee to provide legislative governance to issues related to nutrition and food unavailability. This is aimed at, through appropriation, to increasing domestic resource mobilization for nutrition-specific and nutrition-sensitive interventions, thereby providing a fallback position to ameliorate shortfalls in commodity availability via donor fatigue.
Our country owes unifying framework to ensure coordinated actions, placing delivery and accountability where impact is felt most, at the community level. This administration has also placed strong emphasis on sub-national leadership because the true test of our nation's agenda is not what is written in Abuja. It is what is implemented across the states and local government areas and, of course, at the grassroots, where mothers make daily food choices and children either thrive or fall behind.
The federal government launched several key documents to guide future action, including the roadmap for scaling multiple micronutrient supplementation and a nutrition in emergency strategy. The Minister of Health and Social Welfare, Dr. Muhammad Ali Pati, and the Minister of Agriculture and Food Security, Senator Abubakar Kyari, jointly inaugurated the National Micronutrient Deficiency Control Advisory Steering Committee to strengthen intersector collaboration between health and agriculture.
Members of the committee.
So I hereby inaugurate members of advisory committee, of course with the co-chairs as announced and the membership list as announced. We look forward to your constructive engagement and your candid advice as we move forward with the actions and the learning as we go. So thank you for your service. Thank you very much. You are inaugurated.
Thank you very much, Honorable Minister. I'd like to invite the Minister to this side of the wall.
The conference served as a platform for various organizations to coordinate efforts and align on strategies for improving public health outcomes.
So, bouillon is a food vehicle that is consumed widely. How many of us are taking it as this food? I am sure the sauce, the soup, the stew, the rice, whatever it is that you take, there will be and the two of us. Bouillon is a nutrition value that we consume every day, irrespective of the income, irrespective of where we live. And so for us, public health is a practical, evidence-based public health approach because it's a vehicle that we use to get the essential macronutrients onto the plate of everyone. Iron, zinc, vitamin, folate, just name it. What does it do? It ensures that we have improved maternal and child health indices. It reduces deficiencies. It improves the immunity of the child. It improves the development of cognitive child survival intricacies. So for us in Nigeria, I would say that bouillon has contributed to improving public health status.
Bouillon fortification is voluntary, it's not mandatory. Therefore, manufacturers have the privilege or should be encouraged to innovate at their own pace while still maintaining safety guidelines. And we can also help out investing in testing capacity to support product development, educate the industry on and guide them on regulatory compliance, maintain strong marketing surveillance to protect consumers, and also allow voluntary certification for early stage innovators.
Bouillon, because of its ubiquity of about 98%, meaning that it has that high penetration into the consumers, both rural and urban, just like the director just said. So it simply means that as regulatory agencies, we must be able and we should ensure by virtue of our mandate to establish that standard that speaks to how do quality and safety get to individuals. Our role is to establish standards for bouillon fortification. We should also ensure that we bring the issue of quality and safety there by ensuring that we enforce the standard through conformity assessment program. However, it's very important that we should take note that in advanced countries, because of quality standards being developed, unlike the context of our country, so this has been a big challenge in terms of sometimes complying with the requirement of standards because the country is so big and you have individual policies at the back of their backyard, making that a distorted compliance for reason that manufacturers will do everything humanly possible to produce goods that will meet requirements, but somebody is there. So these are contexts that we must take into account. But for us in the standard organization of Nigeria, we do this in collaboration with stakeholders because we don't develop the standard. We serve as a team. We bring the expertise of every relevant stakeholder into discussions and we must arrive at consensus.
When it comes to bouillon, just like any other product, we expect the manufacturers to comply with the standards and regulations. Most especially informing our consumers in their packaging. So we are particular about the labeling. Apart from the contents, that's why sometimes we pick some of these products or where there are companies go ahead and analyze them to ensure they comply with the standard provisions requirements.
Discussions emphasized the need for agriculture-led solutions that prioritize nutrition and food quality, promoting the use of biofortified crops and strong food fortification policies.
We agreed that it is on the scale-up stage that private hospitals will be involved. Of course, you know that you hardly see anyone going to private hospital that cannot afford it. And that's the reason why they even went there in the first place. So we want the primary health care to get these products, enough of it, before we now scale up. You know, we have rollouts and scale up. So right now we are still in the rollout stage. Then for sustainability for the states, remember that state is autonomous too. So it's not just federal government. States need to be involved. And the costed, I am aware that Lagos State have developed their costed implementation plan. And there were a lot of activities, and MMS is part of the things that are there. So it needs to be incorporated in your operational plan or your work plan so that you will not lack it. Thank you very much.
Thank you. And when we're talking about cross-cutting activity, there must definitely be the collaboration. And what Mike said, what Dr. Dean said, you find out that all these things are taking place at the PhD centers because over 70% of the population, the first place they will find themselves is at the PhD. So we need to strengthen. So we're talking about change. One of the key things we've done during the FPL facility, we've trained over 60,000 frontline healthcare workers. And one thing that I'm sure we did was having a module on nutrition, on like using 1 hour and something that you just brush through. This is actually practical. In fact, not even in the classroom, they have to go to the facility. Occasionally, they tell them to look at the child that is malnourished, that you have to look at, and then after you are giving it to the parents or the mother will bring them back. So those are the things we've been able to do. That is referring to the capacity building Dr. James was talking about. Because if you don't equip these people, bringing nutrients is not what we see. You understand? I'm telling them this is what this means, and this is what you look for. So being able to do that at the facility.
There was a panel discussion on assessing how micronutrients affect health before and during early pregnancy.
Micronutrients matter because high body often overlook. Most of the nutrition program, do they really speak or intervention address the need of the children who really have condition as a result of deficiency? Evidence shows preconception nutrition is equally critical. It is not just critical, it is the foundation before conception. And you understand what I mean as the time goes by. The first 100 days of life, we all know it. I don't need to sing to the choir, but I just want to say that health outcomes are influenced before pregnancy. Health outcome. When mothers like me do not even know that we are pregnant.
So before a woman actually gets pregnant, she needs to be in optimal nutrition state. The most important nutrient that is preventable, the consequences is preventable, is folic acid and iron. But the folic in our food is not stable. The folic in food is not stable. So it needs to be taken in as a supplement. And that's why supplementation is important. And when the deficiency is severe and the consequences are enormous and severe, it is supplementation we're supposed to. Iron, folate, calcium, vitamin. The cooking processes are, the way we handle our food, even makes this nutrient very difficult. So it needs to be supplemented in the diet. So before a woman is planning to get pregnant, and I just said, I did not say NYC, core members represented in the city. These are representatives of the youth of those that are trying to get married in the next 2 to 3 years in Nigeria, and they are not in this meeting for us to communicate with them what nutrition body wants them to be doing and communicate amongst themselves. So, folic acid supplementation, iron supplementation is very, very important. So, it can be prevented. All the spinal bacteria we're talking about, all the chemicals that will now be stressing the pediatric surgeons about, especially people hearing all these things, all these diseases. When we can prevent it by supplementation with the right micronutrients, because the food cannot provide. We're looking at including children especially, or just to engage marginally to help us focus on those group of children. Because when we have a program, they don't exist. But they are there somewhere, right? In their homes, behind us. And most of the time, parents don't even take them for services because of the challenge of stigmatization. So, for the state, local governments, and where they have autonomy now, it's start getting money. When we are developing programs, let us ensure that this year is programs are captured. In terms of service delivery, one of the things that is required, of course, is capacity. And I know for my saying, you mentioned, and that's why it stops. Nobody goes further to look for those children, whether they exist or not. And I know what we find them, the passion and the grace to actually address them. That's how they're telling you, don't touch that time. Because they think that it is a plague. And no infectious one. But that attitude has to change. And in terms of service delivery, they are captured. And as such, there's also need for accountability. How many are they? Where are they? What service do they need? What service do we render to them? So if you look at this in terms of from policy directions, from the service delivery, from in terms of engagement at all levels, out to the household level. If you do that, we'll be able to shift the directions in that will accommodate those children with special needs. And I believe that before the end of this panel, all of us will have been converted to be advocates and change agents for this group.
These efforts highlight the country's renewed push to create a healthier nation, boost productivity, and make sure people get the nutrients they need. Key takeaways from the conference included the inauguration of a new National Micronutrient Deficiency Control Advisory Committee to oversee efforts to tackle micronutrient deficiencies, the launch of strategic documents, including the roadmap for scaling multiple micronutrient supplementation 2025 to 2029. Government reaffirmed its commitment to tackling malnutrition under the Renewed Hope agenda, with agriculture and health sectors to collaborate more closely. In addition to this, stakeholders pledged to build stronger data-driven nutrition systems, among other commitments. And that wraps up this episode of Health 247. Tune in next week for more. Until then, eat well, stay healthy, and take care.